Hey, this is Dr. Tim. I want to take a few minutes and talk about the expanders that I use in my office that we use for our phase one orthodontics. Basically, phase one to me is just about redirecting the growth of the skeleton of the upper and lower jaw. We're trying to develop a healthy, symmetrical skeletal system. As now within our modern world, we're all developing smaller jaws, smaller faces, smaller mouths, which lead to crowding of our teeth, small airways, poor space in our mouth for our tongue, affects our TMJ, sleep apnea, all types of things. So I've given you a bunch of resources typically within that first visit that explain a lot of the stuff that we're talking about, the why, the how, what we're doing behind the early intervention. And the whole goal with the early intervention is to break whatever cycle that the child's on, whether it's mouth breathing and large tonsils, crowded teeth, poor jaw growth, poor sleep, poor behavior, whatever it is. Let's intervene. The earlier we do it, the research shows, the better off we are. And it all comes down to the skeleton. The skeleton's the driver of the airway and our overall health within the face. So the expanders, when I talk about, it's not really expanding. Let's just get the growth back to where it should be for wherever your child's at within their growth journey. The beautiful thing is when we start early, we are harnessing the power of your own child's biological growth through the expander. So the expanders actually integrate into your child's biology and work on guiding the growth. So the expander that I use on the upper looks like this. So it has a clear acrylic pad on the top with our screw in the middle. The screw is what we teach you how to turn once it's inserted. These acrylic pads, I think of it almost as an orthotic or an appliance that we use for people undergoing TMJ therapy. The acrylic pads provide stability and balance to the lower jaw, the lower teeth, when they're resting on this appliance. Most kids will say when they start to wear it, their jaw feels comfortable, there's balance, there's symmetry to it. So what the research shows is that when the lower jaw is symmetrical and balanced, we're working on making sure the jaw joints are seated where they should be biologically within the joint space. The lower jaw grows from that joint space down and forward. So one way of aiming to guide the lower jaw to grow forward is through balancing the jaw. What also happens is the acrylic pads in the back of the jaw take the back of the jaw and cause growth vertically here. This vertical growth redirects the jaw from growing vertical to growing more horizontal. What that does is it provides a counterclockwise rotation of the lower jaw down and forward this way, which increases the height in the back of the jaw, increases tongue space and airway space in the back part of the jaw. Now, when the bite's balanced on both sides, it also helps promote symmetrical forward facial growth, and we can work on taking out any asymmetries and cants that we may find within the face. The earlier you start on this, 5, 6, 7 years old, you may notice that your child, especially on the upper, since we're physically growing the jawbone, the eyes look more open, the face looks more broad and big, the smile looks big and symmetrical. It's a beautiful thing. Most parents look at their child and like, oh my gosh, this looks so good and stuff. And so that's the whole goal. So when we have the structures from space in the mouth for the tongue, proper tongue function, which we may achieve through myofunctional therapy and or tongue tie releases, when the jaw's balanced, when the muscles are relaxed, the muscles, being relaxed are not like a headgear effect impeding the growth of the face. We're taking mouth breathing out, which impedes the growth of the face. It's a negative force. And large tonsils, a negative force impeding the growth of the face. So when we balance all of these structures in our jaw size and our jaw joints, then at the end of the day, the teeth are going to be coming in a more natural position. And then as the child ages into the early teenage years, it may not 100% prevent orthodontics, but we've done all the hard work already. Now all we have to do is slot the teeth in, level and align the teeth, which can be easily achieved in a minimal amount of time, usually a year and a half or less, with either braces or clear aligners, something like Invisalign that's common. It makes it super simple and easy for your kid down the road with that. At the same time, we're using an upper expander. We'll go in and use a lower expander as well. A lower expander typically that I use looks like something like this. The screws in the middle, there's bands that go on the teeth. Now the lower jaw, the mandible, is a different type of bone than the upper, so we don't get pure expansion like we do on the top. The whole goal on the lower is to take the teeth that are tipped in, let's upright them, let's push them out. The whole goal with part of that whole first phase is that we need to maintain arch coordination, meaning the upper and lower teeth need to still lock in. We maintain a good bite. The bite, balance, symmetry feels much better for your child. So that's a quick brief overview on phase one. Hope that helps as you get home. If you have any questions, comments, please reach out to my team. We will help guide you with any other thoughts, questions on phase one. Same thing with my orthodontic assistant. Thank you.